Good afternoon, folks. Thanks for being here. I'm Dan Tsai, your health director here in San Francisco. This is the time each month when we go through what the latest overdose death numbers are here in San Francisco, and we highlight some of the things that we as a city are doing to really combat the behavioral health and opioid crisis. Let me start with some of the numbers, and then I have a few colleagues and partners up here, which I'll note in a sec. So, for the month of April in 2026, we had 33 overdose deaths. 33. That is the lowest month on record since the Office of the Chief Medical Examiner began tracking this in 2020. And I just want to thank again the OCME for their support every single month and making this data available to us at this timeliness. So we are on the lowest monthly overdose death rates on record since the city started tracking this in 2020. In April, the 33 number is 43% less than last year. Last April, we were at 58 overdose deaths in the city, April of 2025. Year to date, meaning January through April, we are at 184 overdose deaths as opposed to 257 in the same period last year. So year to date, we're at a 28% decrease versus the same time last year. As I always note, I am encouraged and I'm pleased that the numbers reflect this sort of forward progress, and every single overdose death, so still over one a day, is preventable. It's unacceptable. We are really doing everything we can as a city to really get around and support this, and there continues to be more work to do. So there's two things I want to highlight, again, as one of many factors driving the progress we're making here in San Francisco. The first is I've talked at some of these press conferences before about an incredibly innovative program we have called BEAM, which essentially allows us to help ensure there is a clinician that can prescribe medication for someone's opioid use disorder, basically at any point of the day or including into the middle of the night. That has been an incredibly exciting, effective program, and we just hit 10,000 clinical encounters, meaning individual clinical visits with individuals here in San Francisco, getting them started on medications for their opioid use disorder. A really important part of that is having clinical teams on the ready and a place where we can often very quickly during many hours as well dispense and start medication. The other piece of this is having the right resources and support and outreach to folks in the streets or in other areas needing treatment. And so Code Tenderloin, Code TL, has been working with us running a night navigation program where they are on the streets way into the night till about 3 a.m. in the mornings. I've been out with them seeing what they do. They are there, they're persistent, they're skilled, they're loving, and they're very proactive in really trying to help folks understand their treatment options and very quickly be able to, even at 11:30 p.m., get someone literally on the phone with a clinician that can prescribe a medication and to get them started. And then at 9 a.m. the next morning, actually be able to provide case management with them as well. That has been a pivotal part of the success of this program. I think I am biased, I would admit. I think this is probably the most innovative thing going on in this sort of street context anywhere in the country. And so I'm really proud of what Noel, Dr. Martinez, and others at DPH have done working with their colleagues in the community. The second thing I just want to note, which is I think a really exciting trend as part of this, is some number of months ago, I talked about what we as a city are doing to really advance getting folks started, not just on medications, but also a very specific long-acting form of a medication that was much more, for a range of reasons, easier for people to start on. And we have been doing those injections within the department, Dr. Martinez's team, does that. When I'm out in the community and on the street, I hear people talking about how exciting it is and how easy to start this medication for their opioid use. And we are really excited about that. That has definitely driven up both the use of Beam and the success of what we're seeing. So overall, 33 overdose deaths is the lowest month on record. It's still far too many. I'm really excited about the work that we have proactively been doing, including at all hours of the day, and getting people immediately plugged in to treatment, to medication, including with the long-acting form. So with that, I'm going to turn it to Dr. Martinez to go through Beam, and then we're going to have Donna, who is the Executive Director of CoTL, talk a little bit about what they do at night.
Thank you, Director Sy, and thank you to Donna Hillard and our night navigation team from Code Tenderloin, who are phenomenal partners in this work. I am Noelle Martinez. I'm an addiction medicine doctor and the medical director of Beam, bringing expanded access to medications, which is an on-demand program for medications for opioid use disorder. Over the past 2 years, our program has had more than 10,000 clinical visits with people in San Francisco seeking help with their opioid use disorder. Each one of these visits represents a moment when someone reached out for help and our program was there to meet them. That level of accessibility comes from deliberate, innovative program design and our collaboration with our community partners. As Director Sy described, our program was born from a simple but critical observation. Code Tenderloin's night navigators were meeting people on the street who wanted treatment but couldn't access it through traditional channels or care models. In response, we launched an evening telehealth program where navigators could connect someone directly with a provider in real time. That model proved effective and has continued to grow. Today, anyone in San Francisco can reach us by phone between 8 a.m. and midnight, 7 days a week to talk about treatment for opioid use disorder. And we've learned from our patients and from advances in addiction medicine, and we've continued to expand and innovate. We've noted that our patients experience smoother transitions to medication when using an injectable form of buprenorphine, and they were enthusiastic and hopeful about this new option. As a result, Beam opened a walk-in clinic at 1380 Howard Street, co-located with our behavioral health pharmacy, our DPH behavioral health pharmacy, so patients could receive same-day buprenorphine injections. Since May 2025, our program has administered over 600 buprenorphine injections. These injections reduce withdrawal symptoms, diminish cravings, and provide meaningful protection against overdose. One of the most gratifying parts of this work is that as patients stabilize on medication, they call us or drop into clinic to share what's new in their lives. We celebrate their birthdays, graduations of their kids. They tell us about their work, their pets, their interests, their passions. One patient once came to show off his coin collection to our team. During recovery, patients rediscover parts of themselves that may have been dormant during the most challenging periods of addiction. We are privileged to witness that process of rebuilding and to play a role in it. And we've noted the way each of these stories builds upon itself as patients bring in their friends and relatives, eager to connect their loved ones with the same care that helps them. Over the past 2 years, we have served more than 4,000 unique individuals across more than 10,000 clinical visits. Each of those visits represents a moment when someone sought treatment and our program was in a position to respond. Together with the Code Tenderloin Night Navigation team, we have worked to fundamentally expand access to treatment, reaching people at the times and the places where they need support most. Beam will continue to listen to patients and rigorously evaluate our outcomes to continue expanding medication treatment access and effectiveness. If you or someone you know is using fentanyl, heroin, or opioid pills and would like to speak to someone about treatment options, we encourage you to reach out to us. You can call us at 888-246-3333. We are available between 8 a.m. and midnight, 7 days a week, or you can come into our clinic at 1380 Howard on weekdays, no appointment necessary. Thank you.
And now I'm going to ask Donna Hillard, the Executive Director of Code Tenderloin, CoTL, to come talk about the incredible work that this team and many others are doing on the streets and all across the city every single night. Thank you. Donna?
Thank you so much. Good afternoon. My name is Donna Hilliard, the Executive Director of Code Tenderloin, and I'm really excited to hear the drop in the numbers of overdose, but I also wanted to let everyone know that we are super committed in getting that number even lower. There's a lot more work for us to do. And that's why programs like this that are very innovative, actually reaching the populations from 7 p.m. to 3:30 a.m., where most people are not even talked to at that time of night. We are actually reaching a population that cannot get into the clinics during the day, and we're helping them with real-time access by connecting them on the telephone with a doctor. And many of them get to meet amazing doctors like Dr. Martinez right here, who you can tell when she speaks really cares and really takes this work very seriously. There's numerous doctors that are doing the same thing. We also know that there is a large amount of folks that we don't just get them connected with medications, but there's more care that's needed. And so we do that. We connect from our nighttime to our daytime to our beam case managers, who are peer to peer folks who have actually gone through recovery and are helping folks get into long term recovery. And that's really, we know, the number one weapon against overdose, and that is abstinence from this drug. And so that is what we're committed to do and will stay committed to do. And these are the heroes that go out in the middle of the night to make that happen. Thank you.
Appreciate that. Okay, thank you. So I think with that, we'll take any questions folks have.
Thank you all. Huge year over year decrease, 43%. What challenges do you anticipate in trying to get that down to zero for next year?
Right. And so, as I always also say, I say the same thing every month. These numbers will continue to fluctuate. So, we're making forward progress. I do expect them to continue to bounce up and down. And even as I'm excited about the improvement, the number is still far too high. So, you'll see us continuing to really push and making sure we can have treatment options readily available, like the sort of things you heard here at various hours of the day and also in various settings. And we've done a lot to make sure that across our entire system, whether it's in shelter or housing settings or any treatment provider, we are shifting to as much of a proactive, compassionate, and proactive approach as possible to help people move forward on the journey of treatment and recovery.
So I guess in a way, does it remain kind of capacity and what you and other organizations are able to do at this point? Is that in?
So I think there's, if I'm assuming part of the question is what's the rate limiter for continuing to expand the access to treatment around this? And I think we've both added clinically oriented treatment beds as well as getting this sort of both direct peer-to-peer support and the access to a doc or a clinician or medication around that. We are expecting to continue to expand what Beam is doing and to get out to even more settings. So CoTL, we recently, I think, expanded from areas in Soma and the Tenderloin to also now in the Mission. In the evenings, we want to continue to think about the sort of presence that we have again at night when many of the folks that we're trying to serve are in the streets. And we are also trying to expand more clinical capacity of pharmacists and clinicians to be able to prescribe and administer the injections when someone wants those.
Maybe Donna, can you talk about what the night navigators have heard in terms of persisting challenges of why people are maybe not wanting services, why they feel like they can't take that step?
Yeah, I think, and that's a really good question. Thank you for asking. But I think what we hear most is people just don't understand what options are available. Maybe they've been offered something and then the person walked away. What we're doing that's very different is we're talking about it. We're also, a lot of us have went through those different programs and been through those detox centers, and we can actually say, hey, we're going to go right now and we're going to go with you. And I think that helps a lot getting people where they need to go.
Also for you,
Sure.
Donna, sorry if you already said this, how long has CodeTL been working?
So we've been around since 2015. We've been now since 2 years, we've been on the ground with the night navigation program, and we hope to keep continue doing the work.
Yeah. I guess being cautious, not to correlation versus causation kind of, but are there fewer people out on the street, and in a way there are fewer people to connect with? Or I mean, I guess maybe, sorry, my brain's working
That's
faster
okay.
than first and foremost, these overdoses are not necessarily all people who were unhoused. can you clarify where that information is coming from?
Overall, so
The overdose data
yes,
is not necessarily all
right.
people who were unhoused.
Right. The overdose data is from the Office of the Chief Medical Examiner, looking at all decedents in the city where we know it is due to an overdose. And so that is whether someone is housed or unhoused. And so we do see, as you would expect, our overdose deaths occurring in a range of settings, sometimes on the streets, sometimes in a range of permanent supportive housing settings. What's clear in all cases is we know what works, which is getting someone connected to treatment and recovery options. Having start someone on medication massively helps someone move forward in that treatment and recovery journey for all the clinical reasons Dr. Martinez mentioned, and it actually reduces the risk of overdose as well. And I think it would be fair to say we are at the highest number of people we have engaged in this sort of medication around their treatment in the city than any other time before. So that is a good thing. And there continues to be more work to do to make sure that when someone is willing to engage and get prescribed and start medication, there's a whole additional journey beyond that, which is why we've also, not just the DPH, but our housing department colleagues have tried to open up additional sites of care that help on a longer term basis for folks in a range of stages of their recovery, because it's not just about getting connection to treatment. It's a range of other things that will help them be successful in their path. Okay, last question maybe.
Do you have any data on what percentage of overdose deaths are unhoused people versus housed people?
We can follow up with that data. We have by setting of care. We don't know exactly if someone is unhoused or housed if they had an overdose on the street, but we have the location where the overdose happened, and we can provide that information.
And the location includes indoors versus outdoors.
Yes.
Okay.
Yes.
One
Thank
more
you.
question from
Oh.
KQED.
Hi, Spencer with KQED. Just really quickly, I'm sure you already covered this. Heard that the number in terms of the injections dropped by 43%. And you know, you give me examples of the teams that have been working together. Would you say it's been one factor or just kind of multiple factors that have been able to get these numbers down? And around that, you mentioned that they were fluctuating or it could fluctuate. And you just tell me again, like, why is the reason for that?
Sure, and I'll just summarize. Thanks for joining us. For the month of April in 2026, we had 33 overdose deaths, which is still far too many, but it is the lowest monthly count we've had anytime since the city started tracking overdose deaths in 2020. It is a 43% decrease relative to April of last year. We had 58 overdose deaths in 2025 April, 59 April of 2024. This April, we're at 33. And so that is really positive progress. Yes, it's due to many different factors, not just one piece, but certainly one important piece is getting people who are suffering from substance use disorder getting connected to treatment, including medication. That requires having clinicians available at all hours of the day. It includes having the right skilled individuals on the streets or in other settings able to engage folks. And I think the final part of your question, yes, these monthly numbers are they will always move up and down. We're interested in the overall sets of trends there. So I continue to expect them to move up and down for a range of reasons. We're interested in aggregate trends, and we also know that this is going to be related to our ability to get people connected into treatment and also to sustain treatment and recovery options, which is why we're investing this sort of resourcing and work to help people, whether they're on the streets or in other settings, get connected to care. Thank you.